President Cyril Ramaphosa has placed the country under adjusted level 3 lockdown. Under these new restrictions, the sale and public consumption of alcohol will be prohibited. All indoor and outdoor gatherings, with the exception of funerals, will no longer be allowed. The nationwide curfew will now be in effect from 9 p.m. until 6 a.m. Over 50,000 new cases have been reported in the country since the 24th of December. The president has also announced the closure of all beaches, dams, lakes, rivers, public parks and public swimming pools in hotspot areas.
Will be extended from 9 p.m. to 6 a.m. Apart from permitted workers and for medical and security emergencies, nobody, and that means nobody, is allowed outside their place of residence during curfew. Non-essential establishments, including shops, restaurants, bars, and all cultural venues, must close at 8 p.m. The lists of these establishments will be released shortly. We now know that the simplest and most effective way to reduce transmission of the coronavirus is to wear a cloth mask that covers the nose and the mouth whenever in public. Until now, the owners and managers of shops and public buildings, employers and operators of public transport have had a legal responsibility to ensure that everyone entering their premises or vehicle is wearing a mask. But given the grave danger our country now faces, the adjusted level 3 regulations will make every individual, meaning everyone, responsible legally for wearing a mask in public. From now on, it is compulsory for every person to wear a mask in a public space. A person who does not wear a mask covering over their nose and mouth in a public place will be committing an offense. A person who does not wear a mask could be arrested and prosecuted.
I'm now joined by the Infectious Diseases Specialist from Helen Joseph Hospital, Dr. Jeremy Nel. Dr. Nel, thanks very much indeed for joining us. Perhaps we can begin with just getting your thoughts on what the President announced this evening. In many ways, it was inevitable, and people might be saying, is it enough or is it too much?
Yeah, thanks for having me, and a very good question and a tough question. I mean, I don't envy the President at this moment in time. I think that the speech did show that, he and his government are taking this as seriously as it is warranted. And I did like the focus on the super spreader events, things like, to really significantly limit those indoor, close contact, poor ventilated sort of areas where the majority of the infections perhaps happen. And as much as it may sting some of us, I think something like the alcohol ban as well really does work in terms of freeing up beds rapidly in ICU settings, where ICUs across the country are overwhelmed at the moment. I do wonder, though, whether it's a bit reactive and a bit too late. I think that it's important to understand that because this virus's incubation period is anywhere up to 2 weeks, that whatever measures you take today only really start to have an effect in about 2 weeks' time or so, really a measurable effect. And that already takes us to about the middle of January when they said the things would be reviewed. I can't see that we'll see any significant decline before then. It's already obviously a big knock to the economy, and it's something I know that everyone is keenly aware of, but that balancing act is very difficult. And then there were a number of other things where may differ in the individual things. We'll have to wait and see what some of the regulations are, specifically when they come out in the next couple of days.
What would a lockdown or a increase in restrictions such as this be able to do? I remember the first lockdown was about flattening the curve, not necessarily stopping the spread, but just flattening it enough so that the hospital system isn't overwhelmed. What can it do this time around?
I think the aim is more or less the same, and as you rightly say, it's certainly not possible to stop the transmission completely and break the chain of transmission. This virus is going to do what the virus is going to do, and this particular variant may even be more infectious than previous ones. But really, the aim here is to try and attenuate it a bit, to try and, as you say, flatten the curve, so to speak, and just reduce the peak volume of patients such that the hospitals are better able to cope. And I do think it's particularly worrying. I mean, when we saw how much the hospitals struggled in the first wave, all indications are that the second wave is as big, but probably bigger than the first wave.
So December has been quite significant. When we reached 800,000, it took 2 weeks to get to 900,000 cases, and then just 9 days to get to 1 million. So this thing is exploding, isn't it?
It's this is the quickest rate of increase that we've seen since the beginning, that is putting enormous strain on many hospitals, which are nowhere near the peak yet. I don't think anyone, certainly in the Western Cape or Gauteng or KZN, is anticipating that with the numbers we're seeing now is at the peak. It's still going to go up for quite a long time. We're already hearing pretty much horror stories of people being triaged in parking lots and things like that. This is a serious issue for the healthcare sector. I mean, I hope that the measures today, which will come at incredible economic cost, really will work. I am a bit skeptical, though, that it may be too late for many of them to work. And also, it's important to understand that even in the first wave, the lockdown had only a moderate effect at best at attenuating this. We still had a lot of people get infected. By the end of the first wave, in some centres, 20, 30, 40% of people were infected. So it's really not, a magic wand that we can wave to try and really, knock this like some other countries in the first world can.
It seems that, until the vaccine arrives, at the end of the day, actually, it's going to be you and I, what we choose to do every single day that's going to make the difference.
Yeah, I think that's the key point. We know what to do as individuals to fight this. It's the same thing you've been hearing, for the year. It's about social distancing, wearing masks, hand hygiene, and avoiding those sort of high-risk scenarios where there's, significant numbers of people, particularly indoors and particularly in poorly ventilated places. So we know what to do. That still will work this time around if people adhere to it. We're worried about the level of adherence. I think people are tired. There's COVID fatigue, and there's some loss of trust in the system as well. And then in terms of vaccines, I mean, that did make the president's speech today, and I'm glad it did. But the progress so far really hasn't been impressive. That we've missed 2 payments to COVAX, which has now been, fortunately bailed out by the predominantly private sector funded Solidarity Fund. We've seen heartbreaking scenes for us and healthcare workers in this country of Chile, Mexico, Costa Rica, and other middle-income countries already rolling out the vaccine. And it looks like, the current trajectory will only get a vaccine in the middle of next year, which I think will be a failure for this country. And I think as a middle-income country, which has a lot of expertise and has trialed a lot of these vaccines in this country, I think to get the first vaccine sometime in the middle of next year would be a failure, really, from us. Cyril Ramaphosa did mention bilateral agreements outside the COVAX agreement, which is the first time he's mentioned that the government's talking to individual drug companies, which is very much to be welcomed. But these sound like they're quite early still. It doesn't sound like there's any imminent breakthroughs on that front. So it's something we're all going to have to watch and hope and really push the government to do as much as it possibly can.
What can we learn from Northern America, Europe, maybe even East Asia? They've been ahead of us in terms of how these things progress, and we've been copying, by and large, the processes that they've gone through. What can we learn from what they've done to better position ourselves?
In terms of the response to as an individual country, the problem really is that it's so varied across countries. What works for countries which are very wealthy economically and have a lot of social security nets are not necessarily what works for countries, such as our own, which is not doing all that well economically and doesn't have huge financial reserves to draw on. So I think that the balance and what to do, as a sort of master plan is very difficult, and each country does have to figure out its own path. There are obviously commonalities. We know what works in terms of the preventative measures, and we know what works in terms of vaccines. We were never going to be able to compete with the likes of Canada and the USA for the very first wave of vaccines. But I do think that we could do a lot better than we currently are in terms of securing access to vaccines in the more near future. in perhaps what we might say the second wave of vaccine rollout. And I think that's really one of the key things. This virus is not going to go away until we have enough herd immunity, either naturally or through vaccination, and preferably through vaccination.
What do we know about this variant? Do we know for sure that that's what's helping to escalate the numbers, or is it just poor behavior? How does one test? When you're doing the tests, are you just testing for coronavirus, or are you testing for which variant at the same time?
Very good question. So it's definitely a combination, I think, certainly to my mind. The standard test for coronavirus just test for coronavirus. They won't tell you which variant. But thanks to the leadership of groups like CRISP and NICD and the NHLS, these labs which are in South Africa, they are sequencing an increasing amount. And what you can see with that sequencing is that the new variant seems tied to the second wave, certainly in the Eastern Cape and the Western Cape and KZN. In other words, when this new variant kind of starts really being detected at high numbers, that coincides with when the total number of cases really starts shooting up. And there's other evidence as well to suggest that this is probably quite a more transmissible virus than normal. So it is bad luck in the sense that the second wave coincides and perhaps was even caused by this new variant. But it's also true that it cannot spread in the absence of opportunities to spread. In other words, the sort of behavior that we need to make sure that we are doing, like wearing masks, social distancing, avoiding those high-risk scenarios, that is the opportunity that we give a virus, whether it's highly transmissible or less highly transmissible, to spread. And that's really what our focus has to be on as the general members of the public.
All right. Dr. Nel, we're going to have to leave it there. Thanks very much indeed for joining us and sharing your thoughts with us. That's Dr. Jeremy Nel, who's Helen Joseph Hospital head of the Department of Infectious Diseases. And bottom line, it's about what you and I choose to do every single day. As the Secretary General of the WHO said, you've got to, as long as this disease is still around, you've got to treat it. Every time you meet someone, do something as if it's life and death. We'll be back with more after this.